Hi, it's Dr. Arif Rajpura here, Director of Public Health for Blackpool, here to give you an update on the coronavirus pandemic and how it's affecting Blackpool. So, we continue to have quite high rates in Blackpool. So, we're still the highest in Lancashire and have been for the last couple of weeks. So, COVID hasn't gone away and we're getting cases on a daily basis. So, at the moment, we're getting about 90 positive cases coming through every day. So, just a word of caution, please don't think the pandemic's over. I know you can all do more and we've gone back to normal in many situations. It's really important that we're aware that COVID's still here. And I just want to talk through some of the things that we need to do over the coming weeks and months. So, schools have returned, so it's great to have our children back in schools. As parents and guardians of children returning to school will know that secondary and college students completed 2 quick lateral flow tests on site at the start of term, and we're advising those families to continue testing twice weekly at home. Families should test twice a week at home to identify those infections early and help keep things moving smoothly in schools. Things will be significantly different this time round in the schools. Last term, in last academic year, there was a lot of disruption with contacts having to go home. There'll be less disruption this time round with the removal of bubbles and obviously the removal of face coverings as well, and children not having to isolate if there's a positive case in the class. Of course, if there's a lot of transmission happening within a school, then of course me and my team will work with the school to put additional measures in place. Schools are maintaining a lot of protective measures such as testing that I've just mentioned, ventilation, making sure there's adequate ventilation in the school, extra hygiene precautions, and all of those things will help keep children and staff safe and minimise the amount of disruption to face-to-face education. We want face-to-face education to continue in as normal a way as possible for this academic year. If you've got any particular worries that you'd like to talk through, please talk to your school. They'd be happy to have conversation with parents. Going on to vaccines, just a quick overview about the latest vaccine information. So anyone over the age of 16 can now get vaccinated. And our vaccine van is travelling across the town, and anyone over the age of 16 can now just drop in and get their jab. They don't need an appointment. You can also book through the national system. If you're aged over 18 and over, you can book through the national system and get a vaccine that way as well. We've had almost 7,000 people vaccinated through the vaccine van. So it's working really well and has been very popular with the people of Blackpool. The vaccine's available on the vaccine van, first and second dose Pfizer and second dose AstraZeneca. The other thing I wanted to say about vaccines is vaccinations in pregnancy. If you're pregnant, it's really important you have both doses of the COVID-19 vaccine to protect you and your baby. COVID-19 infection can be serious for pregnant women, particularly in the later stages of pregnancy. And it's important that we get our pregnant mothers protected. The vaccines cannot give you or your baby COVID-19. And thousands of pregnant women have been safely vaccinated, both in the UK and worldwide. And so please, if you're pregnant, get your vaccine booked, either online or by calling 119. As you may have heard, there is potentially a third booster dose arriving this winter for those eligible. We're still waiting on the details of that. But it's really important, if you're invited for this, that you take up the offer. It's also really important this year to get vaccinated against flu. We didn't have much of a flu season last time round. That's because we were all following social restrictions. This season, now that there's more mixing happening, we could potentially get flu circulating, and we could potentially get a bad flu season. I'm really encouraging everyone to get their flu jab as well. If you haven't had the COVID jab, please, and you're eligible, please go and get it. We're not going to stop offering the COVID jab to people that haven't had it. So please, if you haven't had it, you can still get it. We could have a tough winter this time round. With people being able to do more and more mixing happening this winter, I'm just a bit concerned about all the winterborne viruses rearing their heads and causing a lot of infection in the community. So please do everything you can to protect yourselves. And finally, just following on from the issues we might have this autumn and winter, stay safe. Please keep following the advice. Wear face coverings in busy places, on indoor busy places, public transport. It's really important, I think, to try and do whatever we can to limit the spread of this infection. So I certainly will be wearing my face covering in busy public places and on public transport. I'd urge everyone else to do that for the rest of this autumn and winter period. Meeting outdoors is always safer. I know we're allowed to meet indoors now, but meeting outdoors is safer. Follow all the guidance that businesses are asking you to follow. If they're asking you to follow certain rules around wearing face coverings if you're moving around the premises, then please follow that advice. Undertake regular testing. Regular sort of lateral flow testing allows us to spot infections and squash infections before they spread. Really important that you get a PCR test if you have COVID symptoms. Lateral flow tests are for people that are not symptomatic. That's defined asymptomatic, non-symptomatic infection. PCR tests are used for people that have COVID symptoms. There's plenty of capacity available, and you can book online or ring 119 to get that test. If you're unsure whether you've got COVID or not, I'd rather you get tested. So please get a COVID test if you're unsure or you have the symptoms. Self-isolate when you're told to as well. If you're positive and you're told to self-isolate, please self-isolate. And self-isolate if you're been in contact with someone positive and you haven't been vaccinated, you'll need to still self-isolate. Wash your hands regularly. Really important to maintain that good hand hygiene going into this autumn winter period. So just some basic messages on what we need to do to keep ourselves and the community safe. Thank you for listening. Please stay safe, and I'll see you on the next one.